To be well.
To live healthy, begin colorectal screening at age 50. As a person gets older, their risk for developing cancer increases.
What if you have a family history of colon cancer? What then?
If your mother, father, sister, or brother has been diagnosed with colorectal cancer, begin colorectal screening earlier. The idea is to prevent colorectal cancer by finding and removing polyps before they become cancer.
Rose did what was right for herself and her family. Her story is familiar, but her story is also unique. Each of us has a unique story to share. Listen as Alice tells her story.
I love the mountains and the trees, and it was just so beautiful. So I found out there were some native allotments open, so I applied for one and I got it. And it's been sitting here for years until I met my husband, and he wanted to build a log house, and that's exactly what I want to do. Pretty big door.
Yep.
I've had this vision for a long time, this dream, and I finally met a man that had the same vision, has the same values and same spiritual beliefs, and we both wanted this dream house where we can have our friends and our family come up and visit. I was brought up by elders, my grandmother and my mother and the elders, that you don't just be idle. You know, we're always doing something with our hands. I do basketry, Yupik Eskimo style. I was taught by my grandmother on my father's side. She was a great basket maker.
Then Alice began to notice a change in her body.
I had bleeding in my rectum. So that scared me because I know the signs of colon cancer, and that's one of the signs.
Although it's true that rectal bleeding may be a sign of colorectal cancer, early colorectal cancer often has no signs. A person can have polyps or colorectal cancer and not have any signs or symptoms.
You can tell a lot about animals by their anak, their poop.
People too.
Look for changes in bowel movements or anak, like changes in the shape of the bowel movement.
Look for blood in your anak or rectal bleeding, diarrhea or constipation.
Abdominal discomfort like frequent gas pains, bloating, fullness, or cramps.
Constant tiredness, nausea, and vomiting.
Losing weight for no apparent reason.
Alice noticed changes in her body.
Not all changes are cancer, but it is important to have them checked by your health care provider.
Alice took action and wisely chose to tell her provider.
So I called my case manager. She had me come in and had colonoscopy, and they found a lesion, and they tested it, and I found out within 2 days that it was cancerous. And it was scary. I got scared, and of course I called my husband right away, and they scheduled me the following week for surgery. Get out of the way. I think it's really, really important to get to know what are the symptoms of colon cancer, and also getting regular checkups and changing a lifestyle, making sure that you get a lot of fiber, lots of water, lots of fruits and vegetables, and exercise, and follow your doctors, have regular checkups.
When I first was told about my cancer, I called my sister in Juneau, and she came right out, and the doctor explained to her that what had to be done. It was scary at first, but I had some good support from my family. One of the things that really helped is my sister made sure I had plenty of phone cards so I can call anybody I wanted. And I was always on the phone calling people, and I had some other friends in Ketchikan who had cancer, and I'd call them up and tell them what phase I was in, and they would talk about what to expect next, and I found out staying busy was really important. But it gave me a chance to really practice on my artwork, and now I do drums for different people for the dance groups. So someone might want a killer whale or a wolf, or I have over 50 different designs I can do now. Now I'm in Metlakatla doing some work, construction work, and teaching my niece how to make drums, and showing her how to do some designs, and she's putting up fish and smoking fish and jarring fish and going out clam digging. Teaching her how to the old ways of putting things up has really been keeping me busy, and she's getting a good education out of it too.
Esther, or Bunny to her friends, has lived in Bethel for 40 years. Often she and her daughter Dolly go out walking on the tundra looking for rhubarb or other wild plants. The mother passes on what she learned about these traditional foods
Here's a tea.
from her mother and grandmother. But there was a time, not too long ago, when even these healthy foods couldn't make Bunny feel better.
Every time I ate, I'd get a real bad stomach ache, and then I'd have a hard time going to the bathroom. And I had talked to the doctor, and so he said, well, we're going to have you come in for a colonoscopy. And it just so happened that Dr. Thorndike was the one that had come out to do the colonoscopies. And they called me and had an appointment set up. And so I went out, and he was the one that told me that I had rectal cancer. And it was about the size of a $50.
Sometimes we are embarrassed to talk about our bodies.
We need to talk about things like the colon, the rectum.
It is important to learn how our bodies work.
To be aware of changes.
To be partners in our health care.
The rectum is the last 5 to 6 inches of the colon, just before the anus. The anus is the opening through which solid waste leaves the body. Rectal cancer is a cancer that develops inside the rectum. Bunny had rectal cancer. After surgery and radiation treatment, because of where Bunny's cancer was found, her doctor recommended a colostomy. Bunny had choices. It took a long time for Bunny to make her choice.
I was totally afraid of having a colostomy. I told him that I didn't want to go with the colostomy bag. It took me a long time, 3.5 years, before I decided to go with the bag. The colostomy bag that I have is located here on my side, and because he did take out an awful lot of my colon, and it's hooked to my colon, and that's where I go to the bathroom. Now I can go boat riding, I can go berry picking, I can eat just about anything I want, and I can travel, which I love doing. Get it early, go see the doctor, and tell the doctor every symptom that you have. Don't leave anything out, and don't wait. I waited a little too long. I have told my daughter that she needs to go and get the early colon screening, and
Hi, Dolly.
if she wants me to go with her, I will go with her, and I will support her as much as she supported me all these years.
Hi, you're Dolly?
Hi.
I'm Dr. Egeman.
Nice to meet you.
Okay, so you're going to get a colonoscopy today?
I am.
Okay, I understand that you have a family history of colon cancer, is that right?
I do. My mom had colon cancer when she was about 54.
Okay, well, it would be appropriate then to screen you a little early. Did you have any questions?
I was just wondering if it was going to hurt.
There'll be some discomfort, and we'll give you medication. And if I recognize any signs of discomfort during the procedure, then we'll give you more medication.
Okay, and am I going to be falling asleep then?
You won't actually fall asleep completely.
Okay.
That isn't the intention of the medicines. However, you won't remember a lot of it. The medicines make it so you don't really remember.
Okay. Other than that, I guess you've answered all my questions.
Okay, well, great. Well, you sign here.
To make a cancer diagnosis, the doctor takes a sample of tissue called a biopsy. Then a specially trained doctor called a pathologist looks at the tissue under a microscope. When polyps are removed during colon screening, a pathologist checks to see if they are malignant, which means cancer, or benign, which means it is not cancer.
It's not really that bad. It's a little embarrassing, but they kind of put you to sleep. You're kind of in a half sleep, and you don't really feel anything, and you don't really know what's going on. And it's the next thing you know, you wake up and it's all over with.
Dolly? Hi, how you doing?
I'm doing okay.
Okay, well, everything went really well. We got the entire colon well visualized.